Hello, hello. Welcome to another episode of the Embracing Joy podcast. We have a special guest, Dr. Kim Tranquada, and I'm very excited to introduce her to you all. And our topic today is how we can find joy in service to others. And we have the health equity expert, Dr. Kim Tranquada. So let me tell you more about our guest. So you'll be as excited as I am to hear more from her because she's such a remarkable physician and human being in general. So she's a board certified emergency medicine physician with 27 years of experience in clinical practice as an emergency medicine physician in leadership and in mentoring. She is the founder and CEO of the Healthcare Alliance for an Equitable World. The abbreviation is HAEW. And she leads efforts to provide international telehealth consultations to enhance global healthcare systems in local areas. Her mission is to reduce human suffering and promote dignity through equitable healthcare and envisioning a world where healthcare is borderless and universally accessible. So, wow, that's just really amazing, Dr. Tranquada, to make healthcare accessible to remote areas internationally so that it's not something that's only available in big cities or in places with enough income. Yeah, so it's just great to have you on. Your bio is very impressive. So after I do the intro, we do a quick game. Yeah.
Awesome.
So
Woo!
game, it's just like a warm-up game. It's called Convergence. And the goal of the game is to see if we can say the same word. Okay. So you'll
Yeah.
say the first word that comes to your mind. I'll say the first word that comes to my mind. And then we figure out the next word that we say has to connect the two words in some way. So
Awesome.
an example would be like if I said kite and the other person said seagull, and then we both said beach because we both found them on a beach, right? Or it just happened to be like something that connects the two words somehow. Okay. Or it could be sky, whatever it be. We try to get to where we say our minds can telepathically communicate to each other. All right.
Fun,
Say
fun.
on the count of three, say the first word that comes to your mind. Okay. 1, 2, 3.
Waves.
Rings. I said ring, waves. Ring and waves. Okay. Think kind of ring.
Riptides.
Oh, okay. So on a scale, on we still have to count to three each time so that we try to say
Okay.
the same. Okay. So 3, 1, 2, 3. Lifeguard.
Sound.
Lifeguard and sound. Okay. Sound. Okay. Sound and lifeguard. Okay. Got one? All right.
Yes.
1, 2, 3. Whistle.
Whistle.
Yeah. We're there. Same, same brain waves. Whistle. All right. So that was fun. So that was our warm-up game. So the first question that I have for you, Dr. Trinquata, is just,
Please
our
call me Kim.
I'm sorry, Kim, of course.
Please call me Kim.
Makes it easier, yeah. Doctor to doctor, of course. All right. So, Kim, the first question I have for you is, the whole purpose of this podcast is how high achieving professionals can embrace more joy in their lives, right? So, you, as an emergency medicine physician with that extensive clinical experience, how have you been able to balance that inherent stress and the high stakes nature of your job with the joy that you have in serving others? And can you share an example of a moment in your career where you felt like you really embraced that joy of being able to serve others?
Yeah, I love this question. So clearly, my profession is high stakes every
Mhm.
single day. And it's really important for me to really make sure that I can extract the joy from that every day to be mindful about how I show up. So before I even go to work, my family knows now. And I think I didn't know this in the beginning, right? That I would
Mhm,
have a routine, a preparation routine, but I do have a preparation routine. I need to make sure I get enough sleep. So I plan from the night before to make sure I'm going to have enough sleep before I go to work.
mhm,
I make sure I eat and that
mhm,
I'm in a good place with a good diet, that I
mhm,
bring food and water with me to make sure I'm going to have what I need to nourish me during the
mhm,
day,
mhm,
and that the trip to work is mindful. You don't want to make that full of stress. And then I really make sure I always enter with the mindset that I am going to make the best out of this day. And I'm going to be a leader in this space and not a victim of what is happening. That's important for me and for the rest of the team.
mhm,
Sometimes in my career, there have been times where you show up to work and the team that's leaving is very stressed out and burnt out from what's happened that day.
mhm,
And the first thing they say is, "You don't want to be here."
mm,
That's not what you want to be greeted with. So I try
mhm,
never to do that, right? I always come up and say, "How can I help you? How can I get you home?" And then the confidence of knowing after all of these years that we're going to deal with whatever comes our way and we're going to do
mhm,
it as a team. You say getting joy out of things.
mhm,
I am so privileged that I get to do amazing things.
mhm,
When I love critical care and very sick, stressful situations, there's something I think maybe about that high and the low, the yin and the yang, how fear and joy live in the same place,
mhm,
how sadness and happiness live in the same place. So great moments are when someone has, for instance, a dislocated hip and you're doing all the very important preparatory work to make sure they're appropriately sedated and have pain medication and that they're going to be safe during the procedure and that you're going to be successful during the procedure, and then you put that hip back in or
mm,
that ankle or
mhm,
whatever it is, and it's
mhm,
perfectly aligned and the patient is pain free.
mhm,
We call those moments flow, and I'm really privileged that I get to experience that
mhm,
on a pretty regular basis in my work, in my career, and at such an impactful way.
mhm. Yeah, you provided immediate relief to someone that could have been, if they were not with you and their hip was dislocated, they would have been in severe pain or they could have decreased blood flow or. So wow. And you're able to do those amazing things day in and day out. But you're right. So when because you do it every day, sometimes physicians or other people, you can lose sight of that, right? That privilege that you have, and also that it is amazing what you're able to do. And you may lose that joy by not taking the time to acknowledge it and realize that you're able to do these amazing things for you and the patients that you're helping. So I really like that. And also the tips, that you're preparing for it. It's a mental state that you have to prepare for and remind yourself to get in. And also you also have your family that you tell them, hey, this is what I need too, so that they're also encouraging you to plan better, to sleep better, to have your food and water, because they know that you're going to be better when you come home
Absolutely.
when you prepare ahead of time. So thank you for that answer. I think it's very important for people to hear. So the next question, Kim, we're going to talk about more about your organization.
Hmm.
So as the founder of this Healthcare Alliance for an Equitable World, with providing international telehealth consultations. Can you talk more about how you came up with this service oriented mission and how you found fulfillment in this new role?
Yeah, well, this it's not hard to find fulfillment in this new role.
Mhm.
But, everything in life takes you to the next step and is a culmination of everything that came before. So,
Mhm,
my whole career, I've been in emergency medicine and on the front lines of healthcare and on the front lines of the part of healthcare that's very much a safety net. So, emergency medicine is the one place in all of the healthcare system where there's no regard for your ability to pay,
mhm,
your what station you are in
Mhm.
society, whether you're a resident of the country or not, it doesn't matter. All people are people, and we treat everybody that comes in. You don't even have to speak the language. Frequently, our patients can't tell us anything, and we still
Mhm.
find fantastic ways to help them. So I've lived a lifetime of that, and that, of course, opens me to the parts of society and the parts of our healthcare system that you may not normally see,
Mhm.
which gives me a heightened awareness of what is inequity
Mhm.
in our society and in our healthcare system, and a heightened awareness that people see me and see physicians as being the center of that, as being in charge of that, when we often feel like we are not at all. And indeed, in the system that we currently work in the United States, we are not at
Right.
all in
Mhm.
charge of any of it, and frequently feel victimized by it ourselves.
Mhm.
And I decided I didn't want to be in that place. I had enough experience, I had enough insight that I wanted to build what should be for us as clinicians, and what should be for our patients, and what should be for the world, and what
Mhm.
should be for societies. And look, if we can't think big, then we can't have big things.
Mhm.
And so I find great joy in being able to embrace the empowering of clinicians and
Mhm.
the empowering of the patients, and putting both of those people in the center, full and center, on the spotlight of how healthcare is going to be delivered, and how the future can be shaped by having healthcare for all people as a basic human right.
Mhm. Yeah, that's amazing. I mean, I really like that if you are taking action on the way things should be, right? Because a lot of us may have a feeling that, oh, this shouldn't be that way. But you may also feel disempowered or feel like, oh, I'm not able to change it. I'm just one person. So this is just how it is, unfortunately. So I'm going to have to cope with how it is versus I'm going to take action towards building something the ideal way of how it should be, right? Because we should care for each other on a global scale. As you said, that with the technology that we have today, it's amazing that we still have so much inequity with so many advances, right? So as we have more and more advances, we find ourselves having more and more inequity, right? So I really like that. I also really I had to write down like if you can't think big, you can't have big things because it's important to also dream and follow your dream in that way. So I love that. Can you tell us about any particular success stories with your healthcare alliance for Equitable World that have been particularly joyful for you?
Yeah. So,
Mhm.
something really important about what you said just now is also what gets people frustrated is feeling like it's you by yourself unable to make a difference.
Mm,
And
okay.
indeed, you can't make a difference by yourself,
Mhm.
which is why one of the most important things that we are doing, and it's in the name of our organization, is creating community.
Mm.
We are an
Mhm.
alliance of healthcare professionals. And what a really big part of what we're doing is creating a global community
Mm.
to uplift each other and to change the narrative around healthcare. And that is extremely joyful, right? When we
Mhm.
can do hard things in community, it's extremely joyful. And one of the great successes of this journey has been the Voices of Healthcare Equity podcast, where, like
Mhm.
you, I get
Mhm.
to interview other people working in health equity across the globe, and being part of that community and connecting that community with each other, and being
Mhm.
connected to them and learning from them, and knowing that together we're all becoming more of a force to make the changes that we need to make. And so community has been a big success story
Mhm.
We certainly help patients. It's unbelievable to me that in less than 2 years, we've done 6 medical missions on the most furthest part away of the globe you can get in the Philippines.
Mm.
If, you take a circle and you bisect it, that's as far as away as you're gonna get, and that
Mhm.
we've been able to take care of over 1,000 patients in 6 medical missions. And when we see people knowing that frequently a large majority of the Philippine population will never see a doctor
Mhm.
between birth and death, and that we are coming and having these clinics and having these doctors on telehealth, and they're being able to get a full medical consultation. We've diagnosed very serious medical conditions. You have to have a lot of awareness that it's a different medical system and you can't do the same things, but you can empower the patients with the information and make the recommendations so that you give them a chance
Mhm.
to actually go and get these things done
Mhm.
and change their lives.
Mhm.
Things like heart disease,
Mhm.
things like hypertensive emergencies, preeclampsia, really it's really fulfilling. And just being able to connect with healthcare, even connecting with healthcare teams
Mhm.
outside of your sphere of influence and learning about how they do their work and becoming a bigger community. During COVID-19, I don't think much of frontline healthcare workers would have made it if we hadn't learned from the people on the other side of the world that were encountering it before us and giving us their best advice on how to take care of ourselves, how to protect ourselves, and how to take care of our patients.
Yeah.
And we'll carry that forward forever.
Yes, I think that, it's so important to learn from those advances, of like during the pandemic, things changed for us in so many ways, and it created that global community in a lot of ways, and that global solidarity, especially, of course, like during certain moments. So touching on the benefits of a situation like that and trying to bring those forward is very important. I like that you discussed on, building that community. And you speak when you do the international telehealth, the consultations, it's from healthcare worker to healthcare worker, most, right? So you're interacting with the global medical community, which is great. Yeah, which is great.
Absolutely.
Because a lot of physicians or healthcare workers may feel, ancillary staff, healthcare workers, especially in remote areas, they may be isolated without that community. So if they have another option or able to ask a question, sometimes that's very helpful for the peace of mind of the healthcare worker and also for the patient. So I applaud that greatly. So I think we discussed a lot of things. So I'm going to start with our wrap up questions. So the wrap up questions that we have are: who is a model for joy in your life, Kim, and why?
Well, my kids, when they're small, are always my number one model for joy.
Mhm.
And I think you can pick any child. Probably the most important child to pick is you as a
Mhm.
child. But they are a mirror for the purity of joy before the teachings of the world kind of dampen that down and put it in a box. So my children have always been my model for joy, and as I mature and become more reflectful, I
Mhm.
also reflect on who I was, and I try to remember who that joyful young girl was
Mhm.
and what would make her proud and what really brings her joy, and really being playful and enjoying playfulness even in serious things. Dr. Majette, when I successfully intubate a difficult patient, I actually have an intubation dance
Oh,
that I
nice.
do after intubation. It's it's nothing special. It's
That's
pretty
wonderful.
it's
Yeah, it's
pretty
like
pretty goofy, but the team understands that it's okay to kind of just be playful and joyful and appreciate that something important just happened and you can just enjoy it and play in it and be fun. And
Mhm,
whenever we do fun things,
mhm,
I try to bring a little joy even into that space. Being serious doesn't always make you more professional, it just
mhm,
builds barriers. And you learn that a lot in international medicine, especially US medicine, and can be very hierarchical. International medicine, it's not doctors doing most of the frontline care, it's nurses, it's community healthcare workers. And we're all on the same mission to make sure that patients get what they need
mhm,
and to make the patients better and to decrease suffering, right? And to make sure people can live a full life. So I don't treat a community healthcare worker or a nurse differently because they're not a physician. And you get that experience and you definitely get to learn that doing this kind of work.
mhm. Yeah, that's so important. But I love, love, love that you have an intubation dance. Like I love that. Not- because it is like it's not easy. It's not easy, and you may not always get it the first time. It takes a lot of effort, but it's you're saving someone's life, and it took a lot of skill and effort to do it properly. And everyone has it could be challenging because everyone doesn't have the same anatomy. You're not able to see it the same way because a lot of our audience may not be physicians.
That's
So,
true.
it's difficult. It's not easy, but your doctor is doing the best to try to save the life. And, some people are very difficult to intubate. So it's like, that's your, what are they in football? I don't watch football, but I was thinking about your football dance.
Yeah, there's a lot that goes into it. You have to plan what kind of sedation you're going to use, what's going to
Mhm,
optimize the patient's
mhm,
oxygenation. There's a whole planning and as I've told you, I plan my day, so I
mhm,
definitely plan my procedures very methodically and to just
mhm.
know at the end of that your preparations went as planned
Planned.
and everything went smoothly. It's very uplifting for the whole team. Same thing when you have a cardiac arrest and you're able to resuscitate the patient, just meeting with that team at the end and celebrating what went well,
Mhm,
and learning from things if they didn't go well is super
mhm.
important.
Yeah, because there's a lot of talk, especially in medicine, we talk a lot about what went wrong. We have a lot of like morbidity, mortality reports to try to address what went wrong. But sometimes that's not as encouraging as also acknowledging when things go well. It's of course it's important to also acknowledge when things go wrong,
Mhm.
but even more so to celebrate when things go well so that you can continue. Positive reinforcement is very important. So that's great. So the last question I have for you, if you were building a cake of joy, Kim, what were your
Mm.
top three ingredients and why?
My cake of joy,
Mm-hmm.
top 3 ingredients.
Mm-hmm.
So, time in nature.
Okay.
I need water, I need trees,
Mm-hmm.
I need birds, sky, mountains, very important.
Mm-hmm.
Time with the people I love, and time to be quiet. I am pretty peaceful in quiet.
That's good. That's good. Yeah. Like, is it outdoor quiet where you hear nature or just quiet or any type of quiet?
I think it's a sense of just time without needing to answer, perform, put energy outside of yourself. Time to have just to be in touch with your own self, your own energy, your own thoughts, to process and appreciate all of that. I think as we've talked today, the importance of just being mindful even in stressful situations is what brings you joy. So it can just be breaths. When I have a stressful shift, I just remember to take breaths, not be you know, settle a little bit and refocus less on what's happening to me and more on what I can control.
Mm, yeah. That's important. Yeah. So this has been a great interview, Kim. Learned so much about how you maintain joy, your organization, and the phenomenal work that you're doing. So if any of our listeners want to learn more about Dr. Kim's work, her website is haew.org, and that's the Healthcare Alliance for Equitable World. You can also find her on LinkedIn at Kim Tranquada. And please like and share this episode with someone that you know will benefit from it, because they definitely will. There's so much wisdom that was just shared here. And please subscribe to learn more about our future episodes. So thank you so much, Kim, for joining us today. Thank you.
Thank you so much for having me on. This was joyful
This
and
was
playful and fun.
great. Thank you.
We did a podcast dance.
Yeah, well, let me add some music then. Hold on, let's add our little music and do the podcast. All right. Bye.